In this skills video, I will be demonstrating how to start an IV. The first thing that I've done is identified my patient. I've done that already, and I've determined which vein is the best one for this patient and for the purpose of the IV. And I like the medial vein here, so that's the one I'm going to be using. And I've explained to my patient what I'm doing. I gather my supplies. Most facilities have IV start kits that have a tourniquet, they have a clear dressing, sterile dressing, and they have an antiseptic to clean the skin. So all that is together. I need to select a cannula or a catheter, and this is an angiocath that I've selected. I also have extension tubing and a saline lock. Sometimes these come attached, but in this case they're separate. I need some saline flush. And some facilities use a stabilization device to stabilize the cannula in the vein. I'm going to be using a stat lock, so I have that ready. And I need non-sterile gloves. All right, so the first thing I'll do is get my extension tubing set. And I want to flush it with the normal saline, get it ready to go. So flush it, make sure there's no air in the line, and I'll leave the saline attached. I'm going to loosen the cap on the end so it's easy for me to get to when I need it. This one is a little tight. Okay, so I'll leave that there. And my angiocath, I want to loosen and get ready. Most cannulas have a safety device on them these days. And this particular angiocath, the safety device is this white button, which when I press it, the needle will retract. So I want to be careful not to press it till I'm all finished. Okay. And now I can open my IV start kit. I have my dressing, a little tape, and here's my tourniquet and my antiseptic cleanser. So the site that I've selected is right here. So I want to put my tourniquet on 2 to 4 inches above that site. And now I can put my gloves on. And I can have my patient make a few fists to help that vein dilate and stand out. So I will take my antiseptic and you squeeze it to release the antiseptic. And I want to use friction in a back and forth manner because that helps the antiseptic absorb into the epidermis better. And then I need to wait till it completely dries for the antiseptic to work. Usually that takes about 30 seconds. On the rubber mannequins, it takes a lot longer. So I'm going to just go ahead. Now, if I felt that I needed to feel for the vein again, I would need to re-clean it. Once it's clean, I can't touch it except with the sterile cannula. Okay, I want to loosen the cannula on the needle. And to stabilize the vein, I'm going to take my non-dominant hand and pull the vein towards me. I'm going to hold the angiocath with my thumb and forefinger so that my fingers are away from the white button so I don't accidentally retract the needle. I want to make sure the bevel of the needle is up. And I'm going to go in at a 10 to 30 degree angle depending on how deep the vein is and how large the patient is, how much subcutaneous fat or edema they have will determine how deep I need to go. For this patient, about a 15 degree angle, 20 degree angle should be sufficient. So I'm going to go right over the vein and one smooth motion, watching for blood in the flash chamber, which I have here, so I know I'm in the vein. And I want to bring my needle down almost parallel with the arm and go in another 1/8 of an inch. Then I can let go with my non-dominant hand and thread the cannula all the way in while holding the needle so that it does not go forward anymore. Once the cannula has gone over the tip of the needle, you don't want to retract it because a piece could shear off. Okay, so I'm in. Now I can remove the tourniquet. I'm going to put pressure on the vein right over the tip of the cannula, and I'm going to retract my needle. Okay, attach my extension tubing and flush it. I'm going to use the gauze in my kit to clean up a little. It's nice to have it for that purpose. And now I will put my stat lock on. So this particular device, it's nice, it has an arrow. I know that aims towards the patient, and it clips right over that little ridge. And then I can put my dressing on. It's this clear Tegaderm, it's sterile. And I want to put it all the way up to the hub of the cannula, but not over it. So right up to there. Smooth it out. Take the paper off. And I will take an extra piece of tape to stabilize this on the patient's arm so that it doesn't roll around in the veins. There we go. The last thing I need to do is label it, so I can take my gloves off. This particular Tegaderm has a label on it, which is really nice. So I can use that label. And I want to put my initials, the date, and the time that I put it in. I want to make sure that my patient knows that if he has any discomfort at any point, that he should let me know right away. I want to make sure and teach him about that. And I will dispose of my needle in the sharps container. Starting IVs is one of the most challenging skills that an RN does. It takes practice, it takes experience with a number of different patients before you become comfortable, and there will certainly be some misses. That's part of learning, but don't be discouraged. The more you practice, the more comfortable you'll get, and you will be able to master this skill.